Friday afternoon to you. It's Julie Etchingham and sitting in for Sheila, and we're staying with the issue of, is it time to get real on paying for social care? Lots of your calls coming in and text messages too. Keep them coming on 845 850. Also going to take on board a bit this hour about the pressures on staffing at care homes. That's another thing that's hit the headlines in the last day or two. 1.6 million vacancies, huge pressure on care home staff, not least because of what they've all been through in the pandemic, of course. I mean, incredibly heroic work going on in our care homes. And these are often men and women working on very low pay and under huge pressure. And now they are facing, the whole of the system is facing another additional pressure because there are really serious shortages. So if you work in a care home, if you're managing a care home, if you've got any insight you can offer us on this, 0345 6060973. We can speak now to Tony Stein, who's Chief Executive Healthcare Management Solutions, which operates around 80 care homes across the UK. Great to speak to you this afternoon, Tony. Hi. Should we just start off on what we're hearing out of Downing Street that is obviously there in all the papers today, just to see what people make of it? A hike in national insurance to pay towards social care and allow for a cap on costs. What do you make of that?
Firstly, I just have to say that any money coming into social care is welcome. It's definitely needed. We've got a growing elderly population and there's funding is required to deal with that issue. What I will say is that I think, firstly, fantastic the government is making they're finally making a decision around the fact that we need to fund this and we need to do it through tax rises. It has to happen. We can't do this any other way, and particularly having just gone through the pandemic, there isn't a lot of cash free and available to fix the problem. The issues for me are twofold. One is I think that unless that money is ring-fenced for social care, but properly ring-fenced, in other words, not just the new money ring-fenced for social care, but making sure that we don't cut existing social care budgets at the same time, just to sort of, if you like, spread the cash around, then I think unless we do that, we're not going to see the benefits. So that needs to be done. That needs to be part of the answer. But I also, and I've said this for a long time, we've got to centralise the funding for social care, because the current system of spreading the money out through healthcare, through the NHS and central government, and funding social care through local authorities just does not work. What it means is that we get suboptimal decisions made that really are around who pays for the care rather than what care is delivered to the right people at the right time. So, you end up with people languishing in expensive hospital beds because local authorities just don't want to pick up the tab for looking after that person. So, we end up paying out more as UK PLC for care.
Yeah, and
so
presumably, you
just
got that classic postcode issue affecting that because some of that burden falls on local authorities.
Absolutely.
Yeah.
And you're absolutely right, Julie, absolutely right, that the current problem is that the unmet social need is largely around those local authorities that are hardest pressed. Usually the larger cities like Birmingham, Liverpool, Bradford, so on. Those where they don't have a huge amount of money coming in, given the relative size of the population. So that unmet need is really high in those areas. And we've got to get away from this postcode lottery for care. And if you look at other systems like Germany, they've done a much better. They've come to a much better conclusion because they've centralised it, and it doesn't matter where you live, you get the same benefit.
Okay.
It's much better.
Now, it's fascinating to hear your take on that. I'd love to know too, if you're operating 80 care homes across the UK, how you are being affected by staff shortages. I mean, 1.6 million care home staff needed throughout the system. I mean, no matter what money you put into it, if we're not getting people in who actually want to work there, it's an extra layer of issues on it, isn't it?
Yeah, Julie, there are so many issues around that. It's hard to know where to begin. I mean, what I will say is that you're right. When you opened this up, you said that these are people who work incredibly hard, doing a very, very difficult job. I've done my stint as a carer, and to be honest with you, even with a degree in postgrad qualification, filling in the amount of reports and forms and bits of paper that you need to fill in these days. It just makes the whole exercise of caring for somebody so much more complicated and so much more difficult. And we really do underrate these people. They do a fantastic job. And it shouldn't be a minimum wage job. It's not a minimum wage job. It's actually a highly skilled job.
How many vacancies? Sorry. How many vacancies have you got in your care homes at the moment, Tony?
We currently have on a 40-hour week 112 vacancies going. It's 4,480 hours, something in that region. Now, we've got vacancies across the piece. There are vacancies in catering, maintenance, domestic, and so on. But actually, for the most part, is carers. We've got 51 vacancies for carers at the moment. And what was always a difficult challenge to recruit into a sector, which is not right for everybody. In all honesty, caring is not for everyone. But in an already existing challenging environment, we now have an additional problem, the mandatory vaccination problem. Mandating vaccines was never a great idea. It really wasn't. And so we will now lose, our current estimates, around 234 members of staff come the 11th of November.
Because they just won't have the vaccine? Because
they won't have the vaccine. Now let's try and not. I mean, I've always said this. I'm not into this criticising anti-vaxxers for refusing to take the vaccine. People have their own reasons for not wanting to be vaccinated. Some are really nervous about it. Some are genuinely scared. And there's a principle involved for some people as well. And we've never wanted to mandate it. But now the government's made that call, we're now in a very, very tricky position. That come the 11th of November, unless something changes, we are going to have to say goodbye to some really excellent members of staff, some well-trained members of staff, people we've invested in over a long period of time.
And what impact directly, sorry to interrupt the flow there, but I mean, what impact directly does that then have on those homes? I mean, these are people you say you're really trained. It's a vocational job, isn't it? You lose one of those. It's not just somebody on your sort of employee sheet. That is care, love, time, commitment, somebody that people in the care home know as a friend.
Yeah.
It's a very, it's a very specific sort of work, isn't it?
It is, and it's going to have a dramatic impact on the residents because they're going to lose, as you say, people who've cared for them, loved them, and looked after them for a long period of time. It's also going to mean, in some cases, that if we can't recruit through agencies to replace that, or actually in the marketplace to replace those people, which is challenging anyway, if we can't do that, then we are going to have to consider, in some of those homes, reducing the number of people we look after.
So it puts a squeeze on places then? Just at a time of maximum pressure.
It puts a squeeze on places, but actually, in some cases, we may have to say goodbye to people we were already looking after. Yeah. And that means people will lose their homes. Yeah. So this is a very serious issue that hasn't really been thought through, particularly given that same requirement isn't in the NHS. So staff could leave our care homes now and go and work in the NHS, bizarrely. Mm-hmm. I mean, obviously, there's wheels in motion to make it mandatory in the NHS as well, but that it hasn't happened yet. So, even if it's only for another 6 months, people could leave us and go and work in the NHS. Okay. A crazy situation when you think about it, Julie.
All right, Tony, thank you very much indeed for talking to us this afternoon.